The rates of obese children in South Africa, it's around double the global average. It's with this in mind that the Healthy Living Alliance is calling for policy changes to help turn this worrying figure around. The Alliance says that highly processed foods have become increasingly accessible and affordable, leading to weight issues and obesity, especially in the poorest and most vulnerable communities and households. Now, South Africa's so-called sugar tax has been in effect since 2018, but the Healthy Living Alliance wants additional policy changes. The question is, shouldn't the focus be on making healthy foods more accessible instead of making unhealthy foods more expensive? Now, let's have this conversation with Nzama Mbalati, who is the Programs Manager at the Healthy Living Alliance. Thank you so much, Nzama, for joining me this evening. This is an alarming figure. I mean, it's approximately 13% of South Africa's children under 5 years that are overweight. And that, of course, like I just said, is more than double the global average. Let's first discuss, why is this such a big problem in South Africa?
Oh, thank you so much, and good evening to the viewers. So one and the foremost thing that I think we're picking up in terms of the child obesity in this country is diet plays a critical role. So children eat the food that we eat as adults. And obesity is it's a cross-generational issue. So an obese mother, for example, an overweight mother, is most likely to actually transmit that to the child. And by that I mean, if the mother has a poor nutrition, pre-conceive and during pregnancy, the child is most likely going to be also obese and overweight. The diet is playing a critical role. So we have moved away from our traditional way of eating, but also of feeding children and infants when they are born. There are a lot of aspects also, if you look at children under 5 and above and adolescents, that because of safety issues, roads are not safe where we're staying, car drive faster, there's a less and less body activity that is also happening. But diet is playing a very huge role. And South Africa has become a fertile ground for ultra-processed food as a low and middle income country. So we are seeing more and more children being obese, and actually it's a multiple epidemic with stunting as well due to poor nutrition in the food that we consume.
Now, of course, you are saying that the health promotion levy or tax, sugar tax, it's not enough. You want wholesale policy changes to, of course, combat child obesity in South Africa.
Yeah, certainly. So if you look at how accessible the unhealthy food is a big concern. So I can give you an example practically. If you were to go to a supermarket now, you're purchasing food. When you're passing through the aisle, for example, where you're paying, you're going to find sweets there. So it's not easy to avoid children crying and wanting you to buy them sweets at that point, at the cash point. So we are saying that a lot can be done, to actually remove ultra-processed food and unhealthy food and beverages through a strong food regulation. So one of the things that we think is a big problem is the marketing of children to children of unhealthy food. So from formula, so children, like I've said, they eat the food we eat. So what we eat and what we expose them to, and one of the things that people do not know is that sugar is very addictive. It's not only tobacco. So when you introduce your children, what are kids taking to school as a lunchbox, for example? It's a lot of snacks, it's a lot of food with fat, excessive fats and salt, which is a big problem actually, and what we're seeing. So we want a strong regulation of the food environment. That's what we're calling for. So a marketing restriction policy from audiovisual. So what is playing now when at the prime time when we're sitting with children on TV and on radio? What is it that now we are going to see when we Google for information? What first pops up is actually advertisements of ultra-processed food. So children start to see ultra-processed food as something that is cool. There's a lot of actually not blaming because the industry is strong and has muscles. Celebrities who are actually endorsing the unhealthy food products. And as a result, now children and young people and adolescents see ultra-processed food as something with high esteem. And I think if you look at even accessibility that you're talking about and affordability, I come from Limpopo, for example. Um, Fruits and vegetables aren't necessarily expensive, and people can access them in their own backyards, right? We do know that we have challenges with access to water. But now, with the vigorous marketing of the ultra processed food and the self esteem that comes with that, is that people have shifted their diets from our traditional ways of eating. Even though we produce a lot of fruits and vegetables in Limpopo, people do not eat it. People produce the food, sell it, and go and buy ultra processed food. So there's a lot that needs to be done, including warning on food, on unhealthy food, having warning labels, because there's less and less awareness in terms of the dangers of the unhealthy food. And we have a growing epidemic of diabetes, of hypertension, of heart diseases, and some cancers, which are actually as a result of which are diet related, and those health conditions are actually depriving us and our children to full potential and to thrive.
Yeah, it's interesting that you mentioned, when it comes to poor households versus, people that can actually afford healthy food. There seems to be this, that poor households are the only ones that are suffering from this condition. But you also said now that, fast food is also a huge problem in this country. And I don't think a lot of South Africans understand that fast food has become a huge problem, especially with children, like you said, being promoted by, for instance, celebrities. So would you say that this problem isn't just for poor households, but also for people that can afford healthy foods?
So certainly, and I think that is actually the crux of the matter. So if you look at how the fast food has studied the market and, and our needs as population and civilians in this country, is the unhealthy food comes with a lot of convenience, right? It comes with a lot of affordability, right? It comes with a lot of you can actually get it. It's accessible everywhere you are. So when you knock off now after the news and your work schedule, you can drive through, a fast food retail to be able to get something to eat. So what is happening is the fast food environment has overtaken our needs in terms of what actually the food access to food. So the issue of affordability is a big issue, and one of the things we've been talking about is like, how do we realize access to healthy food? So one of the things we've been calling for as Healthy Living Alliance is taxation, and making that sure that food that is unhealthy is unaffordable, but use that taxation to ring fence, some of the staple food that are healthy for people to afford. So let's give an example. If cold drinks are more expensive, but milk are cheaper, water is cheaper, and other healthier alternatives are cheaper, it's important. But also we have seen that taxation can actually incentivize food producers as well as actually consumers. For
Yeah.
example, we have seen a lot of reformulation into less and no sugar drinks as a
Yeah.
result of the introduction of the sugar tax, for example.
Thank you so much. Unfortunately, that is all we have time for. Nzama Mbalati, who is the programs manager at the Healthy Living Alliance, just basically saying that they want wholesale policy changes when it comes to preventing South African children or preventing obesity under South African children. But of course, here in South Africa, we do have a huge problem when it comes to people's accessibility to healthy foods and the fact that healthy foods are indeed sometimes more expensive.